Hello again. This time I'm making an IV start video. So I've gathered my supplies, except I forgot a flush. Luckily, I got one handy right here. So I need an IV start kit, a 10 mil saline flush, a J loop, and I grabbed two IV catheters. Um, we'll talk about color and gauges when we get to lab on Tuesday. I think we have mostly 22 gauge stocked in the lab, and that is what we typically use on infants and children or older adults with really tiny veins. Um, so anyway, and 22 gauges happen to have a blue hub. So the setup takes longer than actually starting the IV. So the first thing I'm going to do is open up my IV start kit and just look to see, familiarize yourself with what's inside. And you don't have to be sterile about this. Okay. It's got a tourniquet, and tying the tourniquet is half of the battle. So I'm just going to lay that to the side. It's got a chlorhexidine scrub, and I'm going to kind of leave it sitting inside this little pouch to keep it clean. I have a clear dressing, a Tegaderm, smaller than the one for the central line dressing change. I'm sure you've seen lots of these. So I'm just going to set it to the side. It's got a small amount of tape, and I like to tear my tape before I start, because when I get this IV in, I have one hand to work with and one hand to stabilize with while I grab things. So I want to have my stuff set up. For all the years I've been a nurse, I've always torn one sheet like this and then torn that in half. You will get your own pattern, what works for you. But I have 30 years under my belt, and this is how I've done it, and I can't undo it. It's the way I am. And I just stick them to the table so that I can easily grab them. Okay. And then I'll tear one more section or maybe two more. And they don't give you that much on here. That's about all there is on this strip of tape. It's just a little tiny roll. So two little ones and two bigger ones. And then I'll just keep this handy over here in case I need an extra one after I get done. Also inside the kit are a couple pieces of 2x2 gauze. I usually don't use these. The only time that I might is if I need to anchor it up to keep the flow well. But that is not typical. But once in a while, if I have a real positional IV, I might fold one up into twice and stick it underneath the blue hub of the IV catheter. But most of the time, you don't need to do that. This is the thing that gets forgotten all the time. This is your date, time, and initials label. Everybody forgets that. So I'm going to set it off to the side also. All right, I'm going to open my J loop next. And I'm going to try to keep it housed inside this plastic little container, because that'll keep it from touching any surfaces and keep it clean. And I can open up my saline lock flush. And there is a little bubble in here that you have to kind of break. So I'm just going to push out the air. And it always makes a chute when you do that. Okay, now on this, I'm just going to lay this down inside here to keep it sterile so it doesn't touch any surface. This blue cap, this is what's going to attach to my patient's actual IV cannula. So I'm going to take that off, because when I'm hanging on to this after I get this IV in, I don't need to be letting go of that to try to get this cap off. So I'm going to take this cap off and just put it off to the side. I probably should have kept that on and done the flush first, but I'm keeping my tip without touching anything to keep it sterile. But I have to flush this J loop so that I don't give my patient any air accidentally. And this was just opened sterilely, so I don't have to clean this hub this time because I just opened it. But I'm going to just push a little bit of that fluid in until I see a bead at the top. Yep, there it is. So this is ready to go. Okay, I'm going to lay it down in here to keep my tip sterile down inside my little plastic container, and just let that sit for a minute. Okay. You can get your IV catheter open if you want to. Normally, if you're really looking for veins, you'll want to look for your vein first. Um, but this mannequin is a sure thing. So I'm going to not worry about that. Okay. Now, the only trouble I'm going to have is having to move things. I'm just moving things around so that when I move my camera so that you can see that everything's out of the way. All right, so the next thing I'm gonna do is turn this and angle it so you can see what I'm doing. Okay, this mannequin has wonderful ropey veins. You could take your pick on which one of these you wanna use. I'm gonna put some gloves on, and I didn't grab those handy, so my time management is not very good today. You can mark my boxes down. I'm gonna grab a pair of smaller gloves for myself. Okay. And typically I like to look for my vein first so that I can use my fingertips because they're the most sensitive part. That's what guitarists know all about this. You need to use your fingertips because they're very sensitive and they can feel the bouncy vein, and it will feel bouncy to you. So I'm going to first put my tourniquet on. And let's see where I want to go. You may or may not get an actual flashback on these IV arms. So I'm going to put this under here, and I'm going to pull both sides up kind of tight like this. And I have a finger under here. That's to minimize how much hair pulling I'm doing. So I have this crisscross with my finger underneath, and I'm just going to reach here and tuck that edge right there. Okay. And then when I want to let go of it, I can pull this tab and it'll pop right off really fast. So I'm happy with what I see here. I'm going to go with this vein right here. So let me get my gloves on. And I'm letting my patient know the whole time what I'm doing. I didn't mention earlier, but personally, I have a 2-stick max. If I can't get it in 2 sticks, I'm not going to get it. And I'm not going to subject the patient to any more torture from me. So that's just my rule. But the more you do this, the better you get at it. And you will be the person that everybody comes to get because you'll be able to get the IV in. Okay, I'm ready to stick. So now I'm going to break my chlorhexidine. It's kind of like the other thing where you just squeeze it and it will saturate your little pad, and clean it like you really mean it, because you're going to poke through this. And we never want to introduce anything from the outside of the patient into the inside, into their bloodstream. All right, so I'm done with that. And normally I would let this dry, and it dries quickly on a real patient with body heat. Take off your cath. Okay. You'll see that this has the plastic part, and there's a needle down in the plastic part. When I get into the vein and I push this little white button, it will suck the needle down into here. And then all that will be left is the plastic cath. Okay. So I'm going to enter the skin nearly flush with it. So I'm not going to go in like this at a sharp angle. I'm going to go in almost flat with the skin. So I'm going to start my needle. And as I'm pushing this in, I already have a flash. I can see it coming back in here. I don't know. I doubt that you can see it, but I can see a little bit of blood right here. So I'm not going to push this in any farther yet, because if I do that, I'm going to go right out the other side of the vein. So I'm going to stabilize this, and I'm going to push in with the blue and push, and it's leaking very good. I should have went a little farther. Okay. See how well that's bleeding? That's a good IV. Okay. That's why they give you these lovely little 2x2s, because as soon as I connect this, which I'm going to do now, pop your tourniquet off. That'll help stop that flow. But when you see that, you know that you have a really good vein. Okay. I'm just going to clean up my mess a little bit. And I do take a towel with me, because when I get FYI, I used to be really good at IVs. So when I would get them, they would bleed like crazy. I'm just going to give it a flush, and it flushes great. Okay. And I don't have to give it all the flush right now, just enough to help it flush in. If you need to advance it a little farther, sometimes that happens too. But I want to dry this off so that my tape sticks to it. Okay. I'm ready for some tape. So I'm going to take one of my little skinny tapes first, and I'm just going to anchor right across that blue. Okay. And then I'm going to put another one. Now, when you do this, wrap the tape around the tubing first and then put it to the patient so that you're not digging the tubing into the patient's skin. That would be really uncomfortable over time. Now I have this anchored enough that I'm ready to put my Tegaderm on. So I'm going to take this. And actually, if I wanted to, I could take my gloves off now. I'm going to take the backing off. And I want this Tegaderm to go up to the blue hub. Okay. So I'm going to start it in the middle and then work my way out to the edges, just like I did with the central line. And I like a nice, neatly, I'm kind of a picky person about my IVs, but they last when I get them in. Okay, that looks good. I'm just going to flush a little bit more. And I'm really satisfied with this, so I'm going to not flush anymore and clamp this off. Okay, I can take my lock flush off. And then I just take my J-loop and loop it up like this and take one of my other pieces of tape. Again, not pushing the tape into the patient's skin. So you don't want to leave any marks on them. But then I've got my pigtails easy to access right here. And there's my IV start. I kind of want a little bit more tape on this side too, to make sure it doesn't come up. So I'm just going to go across the side to reinforce it. And my patient's happy because it's somewhere where he doesn't have to bend. It's a little bit on his wrist, the tubing is, but he should have pretty good use of his hand too. And probably didn't cause any nerve damage. Okay, this is one of my most favorite skills to do. I hope this helps, and I'll see you in lab on Tuesday.